Choose the chat. I don't know. Does it show this from your end? But the chat's disabled? I don't know why it's doing that.
No, I didn't say that.
Did you get any messages last time? Did you see any?
No, because I was checking. But we can type here. And just make sure to let people know. You can type in the chat window if you have questions. Oops, we have questions. Yeah, there you go. Can you see anything? Did it pop up with ours?
No. Is it host and participants? Interesting. I don't know why it's not showing up.
Well, because you're not a host.
But shouldn't all also the participants see?
Yeah, they should be able to.
Yeah, because I signed up as a participant.
But were you invited?
I signed up to get an invite. Yeah.
Huh, okay.
Yeah, that's why I really want it to work. It'd be nice to send me.
Yeah. Well, I see you, Roy.
Yeah. No, I don't. The chat's not working.
Huh. I'm putting you in there now.
Oh, see, now I got it.
I don't know. Maybe your chat is disabled on your hand.
Ow.
Ow.
Okay.
Sir, I see you. We are currently live on YouTube, and this is our second webinar of the night at our live event. Did we go on Instagram?
No, this time we didn't. Last time, did you want to set it up now? Can I?
Yeah.
Do you have your phone with you? Or do you know where it is?
Oh,
We can just prop it up.
ask Christine. I think she has it.
I'm gonna-
I don't have it.
Yes.
An iPad. I just don't know the quality. Just yeah. But as long as it's showing here, this direction.
Well, I have the new iPad, so it should.
Okay, you just need a stand for it. So you can
Hold it.
or put it right here.
Sí, a mí me gustaría que me suban mis precios, pero también acá, y acá y de acá, ¿cuánto me cobraron?
Hi, how are you?
Haven't seen you in a while.
I know, I haven't seen you in a while. Come on in. Oh, it's that way. Okay. Is that working? Okay, perfect. Oh, you look lovely. Oh, thank you. Oh no, she's gonna go through there. She's gonna go through there.
If you wanted, Dr. G, you could also prop it on the little light bulb. It's nice and heavy.
Huh?
You could do like this.
Oh, yeah, you can do that
How does
too.
that sound?
Unless there's somebody sitting there, that's the only thing.
Maybe. Oh.
She's already doing it on her iPad. Will that work?
Yeah. Oh, that's perfect. Okay, that's fine.
You're on
But you're on the DRT.
one? Okay.
Right here,
I want to kick off my shoes like so bad.
20 minutes to anticipate waiting. For-
Yes, there's Caitlin. Caitlin's on.
Yeah.
She waving?
All right, 4 minutes. I'm turning off the lights. Okay. So
Okay,
more people
yes.
will in.
Rebecca, Ivy, and Esther.
No worries about it.
All right, we'll be starting in about 5 minutes or so. 10 minutes. Hi.
Doctor, this is my mom. You know her one. Sure. You are the one that told us about my problem.
Oh, psychosis. Yes. She has a surgery.
And the surgery is done.
You look so much different. That's why they recognize you.
Because my eyes were down. I mean, you were the my ophthalmology, I mean, doctor, he sees me every year, but he never said anything. You were my savior. Thank you so much.
I'll take it. I'll take it.
If I had not done it, I don't know what, I was not able to see. Now I can see.
I know, and you look different too. You look like your daughter now.
No, now I'm thinking, if you can see the, how do you say, like, the skin, yeah, I don't know if it's.
You look so good, I wouldn't touch it. I wouldn't. You look like your
Just
Letty's
leave it
older
alone.
sister.
But for the scar, maybe you have a cream or something, I don't know.
Oh, I couldn't even see the scar. You healed so well. You had a good surgeon.
Yeah, you remember?
iPad is not, the app for the iPad doesn't allow me to do live.
Oh, does it?
It doesn't for some reason. It's there, the option there. But it's
Can I see if I can do it here? Maybe I'll do it here.
Just like the vitamin C serum inside the sunscreen.
Yeah, there is vitamin C.
It's like the same thing.
Yeah, there's vitamin C and E, but I still recommend this vitamin C separate because it's different when it's in a cream versus when it's
So
in a
put that on
serum.
first.
Huh?
Put the vitamin C serum on first still, and then this one. Okay.
Yep.
Okie dokie.
Trying to see if I can go on live here.
What?
I don't.
Dr. Antech. Right?
And tech, I can't do
I
this.
do tech.
I don't. Where do
We need
you,
a
where do you do
12-year-old.
it? Oh, okay, there. We can
If
go
you want
on,
to flip it around towards you, if you want to do that.
or maybe we could do this. So let's do this, right? They can do it.
I can put it up there.
Yeah, I'll start here and then I'll hand it.
Okay.
All right, we have some more patients on live. Are we writing down names? Because they're gonna get raffle tickets too.
All good.
Are we good? Is everybody in the back, in the front?
Can I give another double check?
Yeah, let's do a last check here. One more patient? Okay.
I think people are checking down, yeah.
Okay,
We were full for 6 o'clock as well.
we were,
People might be late, yes.
people are late.
Yeah, I only had 2 people who came. Oh, come on in.
Better to sit here.
Okay, oops, wait, I need to flip it. I need to flip it to myself. I'm live. I'm live, but you aren't in the video. So just to let you know, you might just hear your voices on Instagram. I'm on live on Instagram right now. We do want to let you know that today's event, today's promotions and the raffle prizes, they will be announced. The winners will be announced on Monday. So we'll go over all the prizes, but it will be announced on Monday on Instagram Live. So if you don't follow me on Instagram yet, please do. It will also go onto Facebook. So if you're on Facebook, follow me on Facebook. And even if you don't show up at 4 p.m. live, it will be in the feed. So you'll see it if you were announced as a winner. If you don't want to be announced as a winner, then let me know. You don't want your name announced, that's totally fine. All right, so we have some people who have joined. Oh, Kat, yes, okay, I'm just, okay. Oh, she wants to be in my live video, do you? I don't think so. All right, let me switch this over, I'm gonna give this to you. So it's gonna be this way now. All right, so thank you so much for attending tonight's event. If you don't mind, Does anybody have any objections if I take off my mask to give the presentation? Okay. It's easier for me to talk, and I'm sure it's easier for you guys to be able to talk to me as well. So what I'd like to do to start off this presentation is to give information. The goal today is to kind of give you what I have learned from doing. Yeah, can we turn down the music, please? Yeah. Totally. Thank you for letting me know. So, so I have been doing facelifts for about a decade now, and the more I do, the more I see fillers in the face. And I want to kind of give information about what I've learned about what works to prep you for upcoming surgery if you do decide to have facelift surgery, or if you're not ready for facelift surgery, what is going to help that won't deter you from problems down the road. Okay. What I'm going to talk about today is, I think, helpful for everybody. This is our first hybrid anniversary event, so I just want to say thanks for putting up with this, because it's part of it is live in person and part of it is online. And I think we have moved into a new era where things are hybrid, where at least some people are working from home with professional up top and pajamas down below. Today I'm not, but this allows us to actually broadcast what we're talking about in person with those who are trying to attend from home and getting a chance to learn too. I do love doing in-person events, and this is our first in-person event in 2 years. So thank you for coming in. I want to say thanks to Susan and Jocelyn. They are both our nurse practitioner and our nurse provider. I'm sure if you come into our office, you've seen them. They deliver all of our non-surgical services. I do a slew of non-surgical services that are specific or specialty injections, but they do a bulk of what I preach here. So please, afterwards, if you have questions, feel free to find Susan or Jocelyn, because they can answer your questions too. All right, so our promotions this year are a little bit different from other years, and my push is going to be towards doing stacking of procedures, and you'll hear why, because after I've learned from, what is going on for patients who've had fillers but don't see a result, it's because we're not, and with patients who have a facelift and don't do other things, they don't see as great of a result. When you combine treatments, you see better results, both for non-surgical devices and for surgery. So I'm going to go over that. And then, so the promotions are going to be highlighted at the end of the night, but I wanted to point them out because tonight you're getting a raffle for attending, and that goes to towards our raffle prizes that will be pulled on Monday. Every $100 that's spent gives you an extra raffle ticket, and that will go into the pool, and we'll pull from that for the prizes that are going to be announced on Monday on Instagram Live. So if you're on Instagram now, just make sure you're following me too. If you haven't yet, follow to see if you're a winner of any of the prizes. And all the promotions are on our website at facesbydrt.shop. So if tonight you decide, you know what, I'm not sure yet, let me do a little bit more research, let me think about it, you have until midnight Monday. So that's Sunday night. When it turns 12:01, the shop closes. So put in your purchases, and then every amount going towards that is going to go towards a raffle ticket for the prize. All right. We will offer free virtual consultations tomorrow, because we understand that you might not understand how to make your decision too as well, but hopefully with this presentation, you'll have a better understanding of what I'm trying to preach and trying to recommend. So this is my recommendation. These are my opinions only, and this is from me, my experience as a facelift surgeon. The Guide to Looking Beautiful at Any Age. You can see this progression of aging happens, and they have looked really good. I don't know what they've had done. These are pictures pulled off of the website, off of the internet somewhere, but you can see this progression, and that would be great if that could be you. And particularly if you could look great at 70, like Cher. All right, so my guide to looking beautiful at any age, I'm going to go over what the aging process looks like first, because you have to understand what I see and understand what's happening to the different levels in the face. And there's 3 layers of aging that I'm going to address, and then what I see in surgery and what I'm tackling when I'm doing surgery. And then how do you tackle aging if you're not ready for surgery yet? But also for my patients who have had surgery, what do you do now that you've had surgery? How do you maintain your results? Because that was a good question. I had one at the last session. They asked, well, if I'm 58 and I'm going to get a facelift, do you think it'll last 10 years, 15 years, 20 years? How do I maintain that to last 20 years? Well, I'm going to talk about that. You need some water? Yes. All right. So what happens as we age? Well, there's changes in the skin. First off is early on is early wrinkles, right? And that might be Botox can address or skincare can address. Those are the early changes. As you get older, the wrinkles get deeper. They become folds, and that's because of sagging. So I'll go over more of that next. The collagen in our skin also gets weaker. We get less collagen. We lose collagen in our skin, but not only in the skin, but in different layers of the face. So your skin becomes less elastic, becomes drier and supple, and the texture changes. That's part of it, hormones as well for us women. Changes in fat. So the next layer is fat. So under the skin is the subcutaneous fat. And in that layer, we have different fat pads in the face. Some of it's deeper under some other muscles, like the SMAS layer of muscle, or it's above. And we're able to move that with a facelift so that we can reposition it. Because what happens as we age is the fat, we lose volume, but also that fat descends because we've lost collagen. There's fascial layers, these fibers that interconnect between the fat up to the skin and down to the bone. So it's like a ladder network that goes up and down. And that's what I release when I do surgery so I can reposition everything. But in order to address that, we might need to put, let's say, volume back to address the fat that's lost, or we might need to release the attachments and reposition everything. The third area that gets changed is a change in muscle. So this muscle is called platysma. This is what we see when we have neck bands. Bands in the neck that start to develop maybe in our 40s or 50s, or the turkey waddle. That's a component of both the muscle being loose plus fat and skin being loose around it. So I have to address that when I tighten. Then the other muscle layer is the SMAS, and that's what I lift with a facelift surgery. And in that layer of muscle, there's also fat as well. So when I lift that muscle, all the fat that's underneath the skin comes up with it in one layer. That's what I do with a deep plane facelift. All right. Changes in our bone, that is something that is less likely to be addressed with surgery. So bone gets lost as we get older, particularly if we're not active, right? We tell patients you need to walk more, be doing activities where you have weight bearing. So you're putting load on the bones. Same thing happens with the face. So if you notice patients who are losing teeth and they're not chewing as much, you'll see bone loss in the mandible. So that happens too with time. So it's important that you're chewing, actually. That we've noticed from looking at skulls from patients who were in the 1900s, and their skulls look different as they were developing compared to how we are now, because we don't chew as much. We have more soft foods, processed foods. So we do have to work on that. But from my side of the things, I have nothing to offer you in terms of addressing the bone loss from a surgical standpoint. For surgery, this is what I see. When I am doing a facelift surgery, I'm releasing some of these fibrous adhesions or septae, that they're called septum, and they attach things down to the muscle, the deeper muscle, as well as to the bone. I have to release that because what happens is as you get older, these start to extend, they start to thin out and they get loose, right? And they start to pull away and pull down, and gravity takes hold and pulls things down. So now I have to cut them so that I can reposition everything back up. And so a good facelift releases those septae and the fascia so that I can lift them back up. So the ligaments get released and everything, and I lift it up. Problem that happens is, what do you do if you're not ready for surgery to address all of this, these layers that are falling? Well, my big word that I'm going to use all night is the word collagen. I think you're going to hear this over and over again, because collagen is not just under the skin. It's in the fibrous septae that are passing through all the layers of our face. So I consider it like ladders or lattice network. It's a web of tissue that goes up to the skin and connects all the skin down to the bone and to the underlying muscles. So that when you smile, you see lines in your face. That's because of the movement of the muscles connecting with the skin itself. So we do have to, in order to soften wrinkles, in order to revolumize the face, in order to address the sagging that we see, we have to stimulate collagen in the face. Okay, so one thing I want to ask everyone is, are you currently taking collagen supplements?
Yeah.
And raise hand. Well, I'll say about 50%. We have a better number last one. So questions on, has anybody heard about collagen supplements? And no? Okay. So I'll tell you, I also was kind of questioning this myself. As a doctor, there's not a lot of studies on collagen supplementation because there's no money in the research. And you have to understand that funding for research usually comes from pharmaceutical companies, right? I think there's a shake of head, yeah. So there's no money to be had in something that really doesn't have a particular drug behind it. It has a patent behind it. So the research that's available is limited. And usually when they've done randomized controlled studies, you have to, how do you blind one side and the other? So you have to get the collagen capsule to look either the same, or if it's not a collagen capsule, you put the powder in the water and it has to not look like anything is in there. That being said, there has been a few studies that have popped up in the last 10 years, and there was a recent meta-analysis that looked at these randomized controlled studies. There was a few out there, and of those, they show there's benefits to skin hydration, the elasticity and density of the skin, but we need more studies. Unfortunately, we don't have a lot of studies. The reason why I got into collagen was because I didn't believe in collagen, but then for fortuitous reason, I was buying supplements for fish oil from a company I depend on, and they got my order wrong. And they sent me collagen peptides. This is Live Conscious. And I got it and I was like, 12 of them, I don't need 12 of them. I want my 12 fish oil. So it sat in my garage for probably a month or so. And then I said, you know what, it's free. They don't want to take it back. So they said, it's yours. So I took it and I started noticing differences in my skin. So hence, now I'm a believer. You're going to probably talk to a lot of physicians who say there's no research behind it. Just because there's no research doesn't mean it doesn't work. Is it going to change your skin entirely where you have no wrinkles? No, that's not what I'm saying. But every little thing will help, and it doesn't hurt to have it in your armamentarium. So you still have to get the collagen to your skin, and that's where we want to stimulate collagen, and we want to do other procedures that kind of boost the collagen into the skin. So I'll talk about that. All right, the 3 layers of aging we can control. So I said bone isn't something that I can do anything about, but I can do something about the skin, I can do something about the fat, and I can do something about the muscle. So what can I do in all these 3 layers, and what should you know? First thing is skincare. So for the skin, whether you're having surgery, you're deciding you're never going to have surgery, you're not prepared for surgery yet, but you want to do something for yourself, whether you're 60, whether you're 20, it doesn't matter. Skincare should start early. So I find some patients come in and they will want their Botox, but they're not even on any Retin-A, they're not on sunscreen, and I'm shocked because Botox sure can treat the wrinkles at this, as they're developing, But if you can treat the skin, you're really getting a complementary, you're getting both affected, because what retin A will do is what I recommend, either a retinol or retin A is the only product that has 30 plus years of research behind it. It's used for acne, it's used to smooth skin, it improves skin texture, it stimulates collagen under the skin, it inhibits pigment production, so you have clearer skin, and it increases cell turnover. So all good things. It stimulates collagen with the help of vitamin C as well. So hence the reason why these two products are in my essentials kit. What I say is essential is a sunscreen, a retinol or retin A, and a vitamin C product. All the other stuff are additional things that you could start to add on top that are in our line. They're not, these I would say are the key. That's your basic foundation. All right, and then last, I said they're collagen again. You'll hear me say that again. All right, so how else can you slow down the aging in the skin? That would be through the use of Botox, Jeuveau, or Dysport. These are all neurotoxins. What they do is they minimize the motion of the muscles that causes those lines to happen in the first place in your skin, right? Because all the lines in our face, they are what we call dynamic wrinkles. They show up when we have motion, because the muscles are moving right under the skin and creating movement on the skin to give us expression. When that starts to kick in and the lines set in deeper and deeper and deeper, that's when skincare people say, yeah, it didn't help me. It didn't help my lines, but that was because you started it too late. You now needed a combination of other treatments to go with the skincare in order to see the benefits. All right. Next thing I talk about is hydrofacial and IPL or photofacial. These are not as strong of effect that will have on your aging, but they're still helpful. So for somebody who's younger, the hydrofacial might be helpful to improve moisture in the skin, hydration in the skin. IPL or photofacial will be improvement of pigment. If you have a lot of pigment issues, red spots, rosacea, that's helpful for IPL. But the other positive is there's studies that show that it reverses DNA breakage that's happening from damage to the skin. Microneedling and RF microneedling are what I'm going to emphasize today. So microneedling are little, if you've seen the pen that we use, it's called skin pen. It's little tiny needles that create traumas in the skin. And with it, it stimulates collagen. We're getting into the layer where the papillary dermis is. That's where bleeding happens. So when we do the skin pen well, your face looks red. Red is good. That means improving blood flow, but also we're getting the right layer to stimulate collagen. So those tiny traumas, every time you make a cut into the skin, is nicking the skin and it's causing the body to have a response to the site, a wounding response, which stimulates collagen production, which is what we want. The other way we do this is RF microneedling. RF microneedling is a newer kid in the block. It's been around for about 5 or 6 years now. But before that, it was known as Fractora, which we had as well. We really like the advancement that has gone from Fractora now to Morpheus. And the reason why is because the needles are more fine. They're more tolerable when you do the procedure. Yes, it's still painful, but it's less painful than what we had with Fractora. The other thing that's positive about it is we're able to tailor it. So we can go 1 millimeter, 2 millimeter depth, very superficial, or we can go all the way down to 4 millimeters. And what that means is, I'm start moving forward, sorry. I had a video on microneedling. I'm not going to go too long on this one. I'm just move forward to the next one. Morpheus is, it can go down to 4 millimeters depth, and that addresses some of the sagging that we're talking about. The muscles, as they start to sag, they're losing collagen, they're losing the fibrous septae. And so we can stimulate collagen deeper than the skin. We can go into the subcutaneous fat, we can go deep to the upper layers of the muscle, not quite the SMAS layer, but you can get deep enough to stimulate collagen production, 1, but 2, also I can control fat in those areas, in those resistant areas that we don't like, which is the jowls. So jowls is one spot, as well as under the chin. I like to use Morpheus to contour the face and jawline with it. So here's a treatment. If you haven't seen one yet, or you haven't had one, this is what Morpheus looks like. Okay, I'm glad we muted the. It's okay. You're not missing it, are you? What I recommend is usually 3 treatments the first time you have it done to stack the collagen on top of each other. So every 6 weeks. And then after that time period, then it's a maintenance once a year. 1 treatment once a year. Okay. So the next part that I'm going to talk about is the fat or volume loss. That's the second layer we're talking about, the subcutaneous fat. So what do we have available to treat fat or volume loss? In our toolbox, what we have is hyaluronic acid fillers. And can anybody give me a raise of hands? Who has had fillers here? I mean, you don't have to say, I guess, if you're private, but okay, good. So hyaluronic acid fillers, if you're aware, is made up of products that are already in your skin. Hyaluronic acid gives you a plumpness to your skin. So it is an ideal filler to use for providing volume. However, I'm going to tell you some places I don't approve of fillers. And you're not probably going to hear this from certain physicians, but from the perspective of a facial plastic surgeon where I'm doing facelift surgery, this is where I say fillers are not, or where I recommend dissolving the filler before facelift surgery. And then the other filler that I like to use is Sculptra. Sculptra is different. It's different than all the hyaluronic acid fillers because it's one of 2 biostimulatory fillers. It stimulates collagen under the skin. So it's longer lasting and it looks more natural in its filling of the face. So I'll go over that too. The other options we have that are more surgical is fat grafting to provide volume. And the next would be facelift to reposition the tissues. So as I said earlier, the fat descends in the face, creates the jowls, and we have to lift it up by releasing the attachments and lifting it back up. So that's the end way we would address it. Here's what I see with surgery and what I want to avoid. So one of the things that we want to do when I do a lift is I lift in this direction. It's up against gravity, but it's also to soften these lines. Nasolabial folds are these folds here, and the marionette lines that people don't like. When I do a facelift, the marionette lines are much softer and the nasolabial folds are improved. I won't say they're gone, but they're improved because all of us have folds. What's not recommended is to put volume there. Fillers there are not the good place to put it because what's causing these folds are actually the tissues falling down. In opposite direction of where I pull, they fall down this way. And that's what creates the folds in the first place. So putting too much there flattens that area out and it can make your face look wider in that area. So then you have a wider lower face instead of volume in the upper face. More youthful look is to have volume in the upper face and an upside down triangle. So we have less volume. So you have sharper jawline. So when I pull and there's volume there, you have to kind of think of it. I'm always thinking it's a tug of war. I'm playing against this filler here now that I'm having to try to lift, and I'm not going to get as much motion if I'm doing a facelift. So the lift is not as good, and it's blocking me from doing my job. So fillers are a no-no in this area. I recommend fillers being placed up higher, but then you get to where there's a limitation. That's how much you can lift with fillers, right? So people think that fillers will lift the face. They don't lift the face. You have to put a lot of volume to lift the face. And when you put too much volume, then you get to see actresses and actors that look overfilled. So the areas that filler is okay, in my mind, is around the eyes, because as we age, volume goes down, right? So our eyes get sunken. So it's okay to put filler under the eyes. It's okay to put fillers in the cheeks because that fat starts to descend. So you're offsetting the volume that's going away. The other area that I am okay with is in the center of the face, because everything falls down this way. You can put volume on the nose if you have, so when I'm doing a non-surgical rhinoplasty, I'll do that. I'll put it in the lips because the lips deflate. I'll put it to the chin if the chin starts to get recessed. So these are areas where I'll do it, but I will avoid the nasolabial fold or the marionette lines. Unless somebody says, you know what? I had a question in the last group. They said, I'm okay not ever having surgery. So what do I do about the marionette lines? And I said, well, then fillers are okay for that. All right. So for surgery, what I see is these areas of adhesions, right? These little fibers, they're important. They're important for the face. And when we overfill in certain areas, not only does it look like it's over projected because the filler can't migrate to some certain areas, or if you do too superficial, the filler drops and now you see movement of the filler. So you don't want to put fillers in the lower face, so you want to avoid that. And you want to do treatments that don't create scarring that's going to be along this muscle that I might be working on for a facelift. Because some of the procedures like Ulthera goes really deep. That treatment goes pretty deep. And when I've done a facelift, I can see scarring under the platysmal muscle when I'm doing the procedure. It creates more scarring, more downtime after the procedure. Thermage is also a radiofrequency device that goes deep as well. We have thread lifts, and FaceTite is something I offer here, which is called radiofrequency assisted liposuction. And it is a good treatment, but I usually recommend it after a facelift. So if I did need additional tightening, then I will do FaceTite. But before surgery, it's going to be in my way because it will stimulate collagen in the areas I'm going to be working. I mean, scars, adhesions in the areas where I'm working. All right, so. So here are my notes from good and bad filler placement. So I don't know if you can see who recognizes this. That is where filler is overfilled, right? The goal is to try to lift, try to reproduce, but you could see that when a patient's younger, you have more volume in the upper face, but if you overdo it to try to lift, then you can get overfilled. And then the other part where they've probably filled is the chin. You see how the chin has widened as well? That's trying to hide the jowls. Here's another area, overfill, and it descends. So this is not a good place to put filler. Anywhere along the lower face is a no-no, and we want to place it higher so we're lifting as much as we can. It's not lifting, it's more of creating volume where it used to be. So volume used to be up higher and it's descended. So we're offsetting what has happened. So properties of an ideal filler in my mind are something that's going to stimulate collagen, because I've said it over and over again that collagen is our enemy that's getting lost as we age, and we want to stimulate collagen. So a filler that stimulates collagen is ideal. Something that's going to stimulate your own collagen, not that is going to inject collagen. There are fillers that in the past injected collagen, but there was also allergic reactions with it, and you had to test it before you could inject it. So we don't use that anymore. These fillers are long lasting, so Sculptra is long lasting. Because it stimulates your own collagen, the studies have shown, have gone towards 25 months, and they stopped it because they had such great results that 80% of the patients were still happy at 25 months. So the research study stopped. That doesn't necessarily mean that it lasts 2 years. It can last even longer than that. And I will say most of my patients, I usually see them back after the Sculptra injection. I see them 2 years later. They still have volume, but they're starting to notice it. So we start doing some touch-ups and we do an injection again for maintenance. It's a polyalactic acid filler. So that is man-made. So when you hear that, you go, oh, are you going to have any problems with it? The profile of this is very good. In terms of the problems I have with hyaluronic acid fillers, I have less problems with Sculptra than I do with hyaluronic acid fillers. And the biggest complication that can happen is a nodule, just the same as a hyaluronic acid filler. But if you do get one, they're typically deep. You can only feel it. You rarely see it. And it's also, the other complication might be a granuloma. So if you have a reaction to the product itself, and that's usually short limited. So if you get a granuloma, it's temporary and then goes away. So that's a reaction. Then in terms of how it looks in the face, it looks very natural. So I'm going to show you some results. You can see this again is just showing you at 25 months, they stopped the study because it kept going, you know, in terms of how many people were happy. And this is the satisfaction rate in 25 months. So it's good for the cheeks. It's good for the temples. I will sometimes inject it into the lower face, the areas where I told you not to, that you want to have injection with hyaluronic acid filler, but it's because it stimulates volume in the buccal fats where we might lose fat or you might lose collagen. Because I always remember you're still losing collagen in the rest of the layers. So that's where I might put Sculptra in those areas that I didn't mark out with hyaluronic acid fillers. And then I've operated on patients who've had Sculptra in the face, and it doesn't limit what I do. So that's a good thing. All right, here's a video of the injection. You know, this is done during the holidays. So the injection is, so you can see in the syringe, it's white and cloudy. So it's a powder and it has to get mixed in water, and we pre-mix it a week in advance. So it's kind of, it's different than hyaluronic acid fillers. We have to prepare for this injection. And then I inject one syringe, sorry, not one syringe, one vial. So it's a vial. I inject one vial per treatment. So it's a slow process. If I recommend it, it might be 3 injections spaced out every 6 weeks until we get to our final goal. So here's a patient, she received 3 vials. Okay, she was not ready for a facelift. So we did 3 vials. This is the improvement she got in the face. Even though we didn't inject down below, you could see an improvement along the jawline. Okay, the lower face, even though I didn't inject in the lower face. So that's the improvement you can see with Sculptra, because it's not like a hyaluronic acid filler. It's not soft and squishy. It is stimulating collagen. So you're going to get a little more tightening than you would, or a lift, should I say, even though it's not a true lift. You're getting more than you would with a hyaluronic acid filler. And then the longevity is great. With this product I'm seeing, as I said, I usually see patients back in 2 years for a re-injection. All right, so what should I expect? So the injections are over several sessions. It's 6 weeks apart, and I usually recommend 3 to 4 injections. I think it might be, yeah, it's okay. And then results build up over months. So the last area that I want to address now is fat sagging in the face, or the muscles as they're starting to sag. That's the SMAS muscle that I'm talking to you about when I do a facelift. So there's not a lot of options from a non-surgical standpoint to address that. We have to address all the layers, but in this layer, what I would say is available are 2 for non-surgical. It's radio frequency microneedling, which I was talking to you about earlier, where we're putting the energy under the skin and stimulating collagen with each treatment. And then face tight, which is we are directing heat under the skin to certain areas to melt fat, such as the jowl fat pads or the chin fat. And with it, we're also tightening the skin, the overlying skin, because it's being placed between the skin and the SMAS. So it's in that fat so that we tighten up the area. You will get some volume loss, so we have to be very careful that we don't overdo this. The right candidate for this procedure is somebody who still has volume in their face, their skin still has good elasticity. It's not like all this loose skin and they're very thin, because then they wouldn't get any benefit from the face type. So those are the 2 options that we have to do for fat and muscle sagging. And then of course, surgery. Here's a result from RF microneedling. This is our compliments of Susan. And you can see the improvement along the jawline and in the neck for her. That was 3 treatments. This is a result from face tight, and you can see the improvement along the jawline and the jowls. You can see the jowls were improved from that. Again, She was a good candidate because you could see her skin quality was good. So this is the question I want to answer for you. So I have two groups. It's usually, I'm not ready for surgery. I'll never be ready for surgery. What can I do? What should I do for my face? We have to really, when I talk about things with patients, I have to talk about it in different levels. Because in your 30s, it might just be skin is all you need to do. All these other treatments that can be done for the skin are maybe the only things that you want to be doing. You don't want to be doing anything yet for fillers, unless it's maybe the lips and whatnot, big lips. But in terms of the skin, in your 30s, it would be Botox with skincare. So skincare is the foundation, I would say, for everybody, no matter what age you're at. Then you start to add different treatments to stimulate the collagen into the skin. Then in your 40s, you're going to start to see fat volume loss or the fat descending in the face. So that's when we want to put volume back into the face using either fillers or we use Sculptra to stimulate collagen, put volume back in the face. In our 50s, we're starting to see more sagging. We're starting to see the jowls. And that's where Morpheus can sculpt the jawline, so you get a sharper jawline. And it can also stimulate collagen deeper in those deeper tissues. So that's what I would have to say about when we get into the 40s and 50s. My recommendations usually are combining treatments, not just doing one. Because if you just did Botox in your 40s and 50s, sure, your upper face might be great, but the lower face, Botox is just not enough for that, right? Skincare is just not enough for that. So we're going to have to add other treatments. That's going to be your Morpheus. That might be your fillers and your Sculptra. And by stacking the treatments, and that's what you're going to hear over and over again, stacking the treatments adds collagen in all the layers where you're losing it, in the muscle, in the fat, and in right under the skin. That's where you want the collagen. All right. So one of the things we want to avoid is fillers in the lower face. I'm going to say this again, treatments that might create scarring if you are planning on having surgery. If you're not planning on having surgery and never will, then it's okay to consider these other treatments that are non-surgical. And then treatments that dissolve fat in the upper face, you would never want that to happen. Okay. Next question is, how do you maintain your results if you've already had surgery? So I have patients, luckily for me, you know, they continue to see me after their facelift. And what I tell them is, if you take your car out of the parking lot and you start driving it, you have to take it to the shop for your maintenance, your oil change, your tire change, tire rotation. Same thing happens when you have a facelift. Aging doesn't stop, so you're gonna have to continue maintaining. Because otherwise, I can't tell you that your facelift's going to last 10 years. I get asked that all the time in a consultation. They'll say, how long should the facelift last for me? Should is the correct underline. Should depends on also how much you do on the backside, how much you're committed to maintaining your results. It should last you 10 years if you do everything right. If you do the things that you need to do to maintain. So I never say to a patient, if they come in, they say, I don't ever want to have Botox or fillers again. I tell them, unfortunately, that's not an answer. Facelifts is not going to help you just avoid fillers altogether or avoid Botox altogether, because the lines are still going to develop. Those muscles are still moving. I didn't cut your muscles that cause you to, you know, the muscle motion. So you're still going to need to do something for that. That's going to create the lines. And then I haven't done anything to the skin. So you're really going to need to do skincare or do something to stimulate the collagen in the skin. You're still going to need to use maybe Sculptra. Maybe you won't need to use as much fillers, but you might need to use Sculptra to just kind of replenish the volume loss that's still happening. Okay. So that's what I would say about what you need to do to maintain after surgery. So the more aging changes you see, the more combination or stacking or treatments are needed to see great results. And this is the whole list. You kind of come down this list and start adding more and more and combining them as you start to see more aging changes. So how many times did I use the word collagen today? Did anybody count? Yeah. All right. Questions? Any questions tonight? Any questions from the audience? Any questions online?
So could you talk a little bit about some of the treatments, like
Yeah.
you're not ready for surgery now,
Mhm.
and but you don't want to do things that would hinder your surgical
Outcome.
outcome.
Mhm.
Could you talk a little bit more about that?
Yeah.
Morpheus versus other things.
Yes, yes. So Morpheus is radio frequency that's delivered through needles. I know I kind of probably skipped through it quickly. Morpheus is delivered through needles. These small needles are allow us to go to different depths. So where has anybody had microneedling before, like skin pen?
And the Fractura.
Yes. So she can tell you about Fractura. Fractura was a cousin to Morpheus. Morpheus is an upgraded version of Fractura, and then the needling is stimulates collagen because every time we make cuts in the skin, if we make a cut, if you've ever had a cut before, you feel it while your skin is healing after that cut. It feels thick. It feels tough. It doesn't move as well because you've created collagen. So you're doing the same thing, but with very tiny needles to stimulate collagen under the skin. And by doing that, we're stimulating it and stacking it in those areas under the skin. Where radio frequency comes in, it's a heat, it's an energy that's delivered under the skin. And that heat also creates thermal damage. It's very similar to CO2 laser. When I do a CO2 laser, I'm creating heat under the skin. And when I do it, you can literally see the skin contract on the table. So that heat is just literally tightening the skin. So the same thing is happening with RF microneedling. It's what I call a baby CO2. It's not a true CO2. A CO2 is a torch to the face, whereas RF microneedling is a torch under the skin. So it preserves the surface and it creates heat under the skin in the areas where we want it. And that's why we can remodel and we can melt fat in the areas that are stubborn, like the jowl fats that we don't want, because it can go deep enough to get there, where a CO2 can't.
Is there downtime with that procedure?
With the Morpheus, you want to give your experience?
Not really. I mean, there was a little discomfort, maybe a little redness, but maybe a day or two at the most. Yeah. I never felt like I could go out.
Yeah.
Okay.
I went out the same day.
It's even less with the Morpheus.
Yeah.
The Fractura it works awesome. It's just a little harder on the patients. The Morpheus is a really nicer step up.
So if you've had Fractura, then you'll feel like Morpheus is a piece of cake in comparison. So I never had Fractura, but from the patients that I've heard that had Fractura, they'll say it's a night and day difference. It changed the game in terms of this treatment because it was hard for me to get patients to get through the whole series on Fractura. On Morpheus, it's not hard, except I've had it done. I'll say I have a low pain tolerance. So every time I do it, I say, okay, I'm done. But yes, we can do blocks. I typically, the way I do it is if we're going to do the jowls, if we're going to do deeper treatments, then I do a block, which is a nerve block. So we block out the nerve to the lower face, to the neck. So it's very comfortable. You can't feel any of it. Right? Yep.
Someone on IG has a question.
Yeah.
How is Morpheus and Ulthera different?
Okay. So Ulthera does not break the skin. So that is an ultrasound technology. All these devices that are on the market that are non-surgical use energy of some sort. Ultrasound is just a different way of delivering energy. So it delivers it under the skin. And by doing so, you're creating the same sort of heat under the skin. And if anybody's had Ulthera, it is painful. You have to kind of consider it's like Morpheus, but in that regard, most people are given like Valium or something. They don't inject the face like we do. They don't do blocks. And so what they're given is maybe some sedation and maybe something topical, but the treatment's really deep and they can't numb that area. So it gets deeper than you would get with a Morpheus, and you don't have any needles on the surface. So it bypasses the skin, delivers the energy deep, and delivers it in columns to create the tightening effect too, to stimulate collagen in those layers. All right, any other questions? Yeah.
How long do fillers
last? 45.
That is a big range, and it really depends on the property of the filler. So it's kind of a big range. So if you said, okay, I have a very thin filler, so the thinner the filler, the shorter the time it lasts. The thicker the filler, so that means it's cross-linked. When a filler is thick, such as Restylane Lift, for example, it's cross-linked quite a bit. So it makes it twice the volume in that same density as Restylane, its cousin. So Restylane versus Restylane Lift is twice the density. Okay, so it's just the way it's cross-linked.
What's the best procedure for uneven skin tone?
That's a difficult question because I really have to know a lot more about your skin other than just uneven skin tone, right? So it would have to be like, okay, what is your regimen currently? How is your skin normally during the winter, during the summer? Are there dry spots? Do you get breakouts? Where are you with your hormones too? Because that can have an effect as well. So it's kind of a complicated answer when it comes to skin tone, but we could probably talk later.
Great.
Yeah.
When you do the facelift, the actual cutting,
Mhm.
when you do a full versus partial,
Mhm.
where do you put the scars?
So when you're meaning about partial versus full,
Like, some people just do half their face and other people do their whole face. And then
Okay.
the neck.
yeah. So here's where I have the difficulty when somebody comes in and asks me for, let's say, a mini lift, or they'll say, I just need a lower facelift, or they'll say, I just need a neck lift. And ultimately, I have to determine where the tissue's going. So I have to lift and feel their tissues and figure out, okay, they have so much laxity. I'm not only going to do a lower face, mid face, I'm going to have to do a brow lift too, because I have to chase all of the looseness and skin. So I can't really give that detail of, let's say, okay, they're getting a partial versus a full. It's determined based off of how much excess skin that they have that's redundant, and the laxity of the soft tissue. So once I test their tissues, then I'm able to determine, okay, they have enough looseness. I'm going to have to chase it up into the temples. That's now a full facelift. Versus I might lift and they've got most of their aging is their neck. Their jawline has maybe a little jowling, and their mid face is still very good. Like the volume in their mid face is good. But once they start having these folds and you could see a break, I don't know if anybody's ever seen in the cheeks where you got this break in the cheek. We call that a nasal pupil groove, but that's a break because the fat pads have started to separate from each other. And that's when I go, okay, now I also have to lift into the mid face. So I kind of look at the different levels and how much I'm chasing to determine if it's going to be partial, full, lower face, neck. Yeah. Yeah. I know that's very
Goes for a facelift.
Yeah.
Do you tell them, hey, when you're coming to me, don't have anything done in your face so that I know what the real you looks like? Like, don't do Botox, don't do this, don't
Yes.
do that.
Yes.
So you want everything
It's
gone.
helpful to have everything gone,
Yeah.
one. And second, if you've had fillers, is to get your filler records and a picture of how you looked like before fillers. Because you will forget how your face used to look. And it's important to know what your facial structure was like, so I could recreate it.
That's what I was told. Don't do any fillers, don't do anything with your facelift so they can see the real you.
Yep, yep, that's exactly right.
Hey, to follow up on the question.
Yeah.
Between Morpheus and Ulthera,
Mhm.
the question is, Morpheus does not interfere with a facelift like Ulthera.
Correct. That's right. That's a good point, because I've operated on patients who've had Ulthera and I've operated on patients who had Morpheus. And Morpheus didn't limit what I did. But when I did Ulthera in the neck, I had trouble under the platysma because the platysma is right under the skin. And so if you do Ulthera and you set the setting at like 4 millimeters, depending on what you're trying to do, if you did it 2D, then there's scarring under the muscle when I'm trying to do my lift. And I have to lift that platysmal muscle. So yeah, it gets in my way. So
I have a strange question. So microblading is becoming very popular now. How does that impact you doing a facelift on someone when they have absolute eyebrows?
I have had a couple of patients who I have suggested a brow lift. It repositions their brow, their unnatural brow, right? Because their brows were tattooed higher, and they have to get the tattoo removed and re-tattooed. Yes, that's a good question. But the problem, and I have one patient that if you wanted to see on my website, where I just did a brow lift, I didn't do upper eyelid surgery, and it solved all the sagging. But it's about diagnosing what the problem was, and if I did upper eyelid surgery, she still wouldn't be happy. And I had to just counsel her and said, microblading wasn't helpful in this case, like you're talking about. It's better not to do the microblade until the lift is done. If you're contemplating getting any eyelid surgery or brow lift, get the surgery done first and then the microblade after. Yeah.
Is it important to start tracking what non-surgical procedures you've done and why?
Oof. Who asked that question? So that is tough, because a lot of times in consultations I'll ask and people just forget all the fillers that they've had done. And they'll say, oh, I did it 10 years ago. It probably is not in the face anymore, right? And the thing is, as a surgeon, I can tell you, I know where I could see filler, where I don't see filler, because the distortion that happens to the face from fillers, you start questioning, okay, is that filler there? Did you ever have filler there? And oftentimes, 9 times out of 10, the patient will tell me, oh yeah, I did have filler there. And so it's crucial to know what type of filler though, because what I do find is there are particular brands and particular thicknesses that will last longer. So we're asking how long does the filler normally last? Typically, right, the company will say 1 year, 2 years. Sometimes it's longer than that. So that's why it's important just to find out what type of filler it was and where it was placed and get your filler records. Yeah. And pictures before. Okay. Any other questions to anybody from the Zoom call on Instagram Live?
So if somebody's had filler in their face
Uh-huh.
and they really want to get a facelift, are they able still to come see you and not wait those 2 years?
Yes. So there is an enzyme. That's a good question. There's an enzyme, hyaluronidase, that I use to dissolve filler. I don't want to overdo it too, though. So when I do it, I'm very judicious on where I'm doing it. I do a small amount and we kind of track it. So we do it and then you come back in a couple of weeks, or sorry, couple of days. We see it dissolves pretty quickly. When you see it, it dissolves within 2 days. And then we reassess the face. If we need to do another dissolving, we do it then. Sometimes it might require 2 or 3 treatments to make sure that it's all gone. Is it glare?
No,
All right. So let me now give you what our promotions are this year. For skin, there's the hydrofacial, 3 treatments in a package. There's the IPL series, 3 treatments in a package. Skin pen microneedling, there's 3 treatments, as well as there's a face and neck. So that's a 6 treatment one. Morpheus 8, I recommend it in the 3 series. Again, like if you've heard me, is stacking treatments. We do this every 6 weeks, 4 to 6 weeks, we repeat the treatment. And then 1 a year after. For Botox, Dysport, and Juvo, we have a 50-unit package for Botox, 150-unit Dysport, because Dysport is a different number system, but they're all equivalent. And then filler package, 2 to 3 syringes. Again, I recommend in certain areas we talked about. Under eyes is a typical spot I recommend. Cheeks, lips, any area up here, but nothing to the jawline or lower face. Sculptra, 3 to 4 vials. For the 3 vial package, there is 90 units of Dysport. And you can find this on the website if you want to find that. 90 units of Dysport free. For the 4 vial package, there's 1 Restylane syringe, whichever product I recommend that comes with it. And then the Morpheus 8 and filler combo, that is with our nurse and nurse practitioner. So with Susan and Jocelyn, that's 3 Morpheus treatments with filler. I think it's 2 syringes of filler, and that's also needs a consultation, so we can tell you where it goes. It includes a skincare kit as well, with all the essentials that I talked about, as well as a post-care kit with the Morpheus 8 series. And then the full facial rejuvenation package is with myself, and that I'm performing the Morpheus 3 series, Sculptra or HA filler up to 4. And then also includes the post skincare kit and skincare essentials. Okay. All of our skincare is off, 20% off until midnight on Monday. And then gift cards, last year we had it 10% off, but we decided this year to do it as a bonus instead. So a plus rather than a minus. So that means if you spent $100 on gift cards, then you would get 110 in terms of value. And we often find that a lot of patients don't know what to get, so they just get this because it allows them to get whatever they need to get. Now, it cannot be combined with a package, so you can't just say, I'm gonna get this and then buy the package. Use this to buy the package, but you can use this to buy whatever else is in the office. Okay. So we do have free consultations tonight. If you're not sure, if you want to talk first, or if you want to take some time, the shop is open as well until midnight on the 14th, Monday the 14th. For our raffles, you're getting 1 ticket per attendee. Today, you probably put in the bowl already, and then 1 ticket per $100 that's spent through 12 a.m. on the 14th. Raffle prize winners will be announced live on Instagram. On Monday at 4 o'clock in the afternoon. And if you miss it, it will still be on our feed. So go there on that day or the day after, make sure to see if you're a winner.
Will you be contacting winners even if you're not able to be on Instagram?
Yes, we will. We'll contact directly. And then follow us on Facebook and on Instagram. All right. So these are the raffle prizes. I'm providing collagen peptides. Whoever haven't tried it yet should try it now. And so hopefully you get to be a winner. And this is, I do it every night in my tea. So I do it with hot water at night. And I usually put a little bit of MCT oil and I put a little honey. And that helps me to go to bed really well.
Does it make any difference whether you're doing it at night versus during the morning?
I haven't found a difference.
So repair is not necessarily taking.
No, but I do it daily. I do it daily. Yes. All right. And then there will be 3 products in our skincare essentials kit. It's a sunscreen, a retin A or retinol, and a vitamin C product. And we'll determine based on your skin type what you should get. And there'll be 2 winners for this. This is Juvo. Juvo is one of our sponsors here today. We'll have 4 winners of 25 units each. We'll have Dysport, 75 units, 4 winners each of this. We'll have Botox, 4 winners, 25 units each. And Restylane, we have 2 winners for this. It will be 1 syringe, and we'll determine it based on a consultation. We'll also have a Sculptra vial, and that will be with me, and I will determine where that will be placed. Skin pen microneedling, we will have 3 winners, and it will be 1 treatment each. And then Morpheus 8 is our grand prize, which is a 1 treatment, includes the microneedling and the PRP with it. And that will be done by either Susan or Jocelyn. And that's a $1,500 value. All right. Okay. Any other questions? Yes.
Question from ID, can they participate on the raffle if they join?
On Instagram. They have to submit their name, so we have their information. Yep. And we'll do that. Okay. All right. Anybody else? Yes.
Is there a big difference between Botox, the dice, or those 3?
Would you like to answer that, Susan?
They're all neurotoxins. They all work very similarly as relaxing the muscle for a certain period of time, usually 3 to 4 months, but that varies person to person, depending on metabolism, depending on if they developed a resistance or antibodies to some of the substance. But
Yeah.
All in all, there is a little bit differences, but they all look the same.
Yeah.
Botox and Juvo are very similar. Dysport's just a tiny bit different, but they all work great. They all have natural reactions, or I should say, the results can be very natural. It just depends on how much is given and where it's given.
If you don't really know what you want to do, you just like.
Well, we talk with the patient, and that's another thing that will be determined in a reviewing with you, what you've had before or what results you want.
Yeah, if you haven't had anything before, then Botox or Juvo are equivalent in terms of that standpoint. And if you tried one of them and it didn't work, then we tried Dysport.
It's the nice thing when we have more than one neurotoxin on the
Yeah.
market.
I've used all three. I will use them interchangeably, whatever I have available for myself. That tells you how they are. They all work well. Okay. All right, very good. Thank you. Thank you for joining. Thank you for joining. All right. We also have a prize down the hall. If you haven't guessed yet how many vials are in there, how many Botox vials, or actually Botox, Dysport, and Juvo. There's a whole mix in there. So go ahead and guess. All right.